Hello, Joe. My name's Mercy and I'm your case manager. I'll be helping bring together different components of your recovery and find the resources you need to make this process as smooth as possible. It's nice to meet you. I want to start by talking about your insurance and financial situation. Does that sound okay?
Well, my family works for all their money, and we unfortunately don't have any medical insurance.
Yes, I understand that can be scary. What I've done is submit your application for Medicaid. Medicaid has very full coverage and will be able to cover all or most of your medical expenses.
What about the treatment he's already had when he first came to the hospital? Will they cover that?
This is what's called retroactive coverage. To get this, you must have been eligible for coverage during the 3 months prior to application when the bill was incurred, and the services must be those that Medicaid covers. Assuming all of your family finances have been the same in the past 3 months, we should be able to get you that coverage. Even if you are denied, I have found multiple nonprofits that can provide funding and grants to cover some of your treatment.
I was worried for my parents because they work so hard already, and I know it would be hard for them to be able to afford medical coverage. My dad works sunrise to sunset, and he does not have much time to take me to appointments either. My mom takes our only car to work every day, and I feel we probably won't be able to pay for rides that will get me to the appointments. I might be able to ask people I know for help, but I'm not sure.
Medicaid offers a mileage reimbursement program to help you get to your appointments. This will pay back gas money to the people driving you to these appointments. I understand you're very involved in your church and school. Those people can also get reimbursed for driving you when your parents aren't available. Lastly, we can arrange your specialist appointments to be on the same days at the same locations whenever possible, or use telehealth when it's an option.
Oh, that helps so much. I really appreciate how considerate you are. It helps to have friendly, flexible people helping my family.
I just want my life to go back to normal again. All these appointments and stuff are overwhelming, and I just wish I didn't have to deal with all of this.
I understand this can be very traumatic and difficult, and your life will be tough for a little while. But I have found some resources that may be able to get you back to the things you love. First, after some of your initial occupational therapy, I want to apply for you to get a partial prosthesis for your index finger. These can sometimes be hard to get covered, but I will get letters from each of your specialists, OT, home health, your teachers, and pastors. All of this will get a better chance of being approved.
That's great. I guess it is nice to have such a huge support system of people who care. Is there anything else we need to know?
Yes. One last thing that I have found is a company that creates custom instruments for amputees. I think we can get your saxophone customized to accommodate your shorter digits. We can contact your pastor to look into setting up a fundraiser, since this will be outside the realm of insurance.
That would be so amazing for him. I really appreciate all the effort you are making to help our family.
Hi Joe, I'm Ashley, your home health nurse. I'm here to teach you how to administer your IV antibiotics and care for your PICC line safely. I'll administer the first antibiotic dose and your parents will demonstrate back to me for the second. It is important that we care for your PICC line and medications correctly to prevent infection or injury to you. I have instructions with pictures for you. Throughout our time together, I will help coordinate your medical care with your infectious disease, orthopedic, and vascular specialists. What questions do you have?
Well, I'm a little curious because I never really have taken any medication before. Could the medication cause me any sort of pain or cause me to feel differently in any way? I also heard that some medications have to be taken with a food or a meal.
That's a great question. The medicine could make you nauseous, so keep a small snack handy and eat something before each dose. The medication shouldn't feel painful, but we do want to watch for allergic reaction, such as a skin rash, hives, or itchy, swollen face, mouth, or throat.
Do I have to do anything special to care for my PICC line or no?
Flush with saline before and after each use like I showed you. Keep the dressing clean and dry. Shower or wash your skin daily to prevent bacteria getting into the PICC line. No tight clothes or items around your PICC line arm, and no contact sport. Now, how has your pain been doing? Are you doing the exercises you learned in the hospital?
Well, it still hurts sometimes. I've been working on the Rome exercises from OT when I can, but I've been really busy catching up with schoolwork, and some of the exercises are just annoying to do. I also have found that the exercises make me hurt even more, so I kind of slow down on them.
Yes, you may notice increased pain when you use your arm more. You can take Tylenol 30 minutes before your exercises, and if it still hurts bad, you may take Percocet, a combination of oxycodone and Tylenol as instructed, but this is a narcotic and could make you sleepy, so should only be used for severe pain.
Hello, I'm Dr. Beasley and I'll be your main occupational therapist. In OT, our main goal is to get your right hand as functional as possible to increase your independence in your daily activity. To access our telehealth sessions, I will send you an invite from a HIPAA compliant system for your privacy. Our top priority for OT is to return your range of motion and increase the strength in your hand following the precautions and the protocol of the injuries you sustained.
Wait, what are precautions? Do I need to follow specific rules or something?
Precautions are restrictions placed on the type of activities or interventions we may do based on your stage of healing. For example, because you had the procedure on your arm, we can start with active range of motion exercises first before we're clear to strengthen. The physician should remove those pins in 4 weeks for your finger fractures. After the removal, you will continue to wear the splint, and then we will start with light active range of motion exercises and then progress to strengthening. As far as the amputation, our main concern currently is how your wound heals. Your overall recovery is going to be a team effort. However, you and your family are the most important members of this team. With this being said, and all the precautions and safety information we have covered, can you tell me what your goals for OT are?
First off, wow, I did not know I would have to be so careful with my hand and arm. My biggest goal is just to have my hand feeling normal again without pain, so I can do the things that I want to do. After my bones have healed enough, what kinds of things will we need to do in OT to get my hand back to normal?
Besides range of motion and strengthening, we will also use modalities and methods for pain management and swelling control. We will also incorporate occupations or activities that are important for you along the way, such as simulated saxophone playing, to promote function. Education is also crucial. Some of those topics may include a home exercise program, splint care, skin integrity, scar massage, medication management, and compensatory methods to increase your independence in home, school, and community activities.